Excellent. The broadcast looks like it's live. I just want to give it a couple of minutes on my end, make sure that we have some people that are already tuned in with us. If you are watching with us, go ahead and give me a thumbs up so I know that you can hear us just fine. I just want to give Facebook a second to alert everybody that we are live on this broadcast and are ready to go. Excellent. Thank you. It looks like State Representative Tracy Kropp-Tharp is on here with us already. Parker I from Carrabba's and Kim Llewellyn. Thank you so much for tuning in with us. Good morning, and thank you again for coming on here and streaming some of our video broadcasts. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and I'm pleased to have with me today Westminster Medical Clinic's very own Dr. Hammond. Now, for those of you that have just landed on this webpage and maybe have not heard from us before, we've been launching these videos as early as March to try and help our business community engage with one another and understand best practices for their businesses in times of COVID-19. So how to adapt business and work to this new environment that you might not really be sure to what you can do and where to pick up from. Those morphed into more structured, and a lot of you have already been following us for that and have seen some of our various job fairs that we have, our mayor that is featured every Monday, and then we generally close off with either district update, county updates, or state updates on Fridays. All those videos are available to you at the video section of this page. Please be sure that you're liking our Facebook page and that you follow us. So in the future, you're constantly alerted as we're going live. Now that we are transitioning more to the safer at home and some businesses are starting to reopen, our content is really being guided from our reopening survey. So as we're receiving feedback from the business community, that is providing us with the direction of who do we need to bring on and what is the message that they would like to share with us. So one of the key items that we've heard is really how are we going to keep our employees and our customers safe as we're transitioning to this reopen phase. So who better than an expert in the medical industry or in the medical field to share with us some tips and best practices. Dr. Hammond has put together a slideshow that I'll pull up here in a few minutes, and we'll have him kind of direct us through. If as you're hearing anything that's of value or you think is incredibly beneficial, something you didn't know or a fact that you loved, we enjoy the kudos. So let us know what that comment was. You know, hey, thank you for this fact, this tip, etc. We'll use it. If you have questions, give us that question so we can address it for you in real time. Share with us question and then paste through what the question is. We'll pull it on the screen and then we'll have Dr. Hammond address that question for you. If for whatever reason we don't have an answer right now, we'll come back to you after the broadcast to be able to share that. I think that's enough of me yapping, and I'll turn this over to Dr. Hammond to really take this away.
Well, thank you. Thank you very much. I'm Scott Hammond. You can put up the slides now and I'll just start running through those. And I'm medical director of Westminster Medical Clinic. For those that don't know, Westminster Medical Clinic has been around, started in Westminster 67 years ago. I've been there, that was when there was just Prairie, and I've been there for over 30 years. The practice is a family medicine practice and is does comprehensive, kind of a one-stop shop family medicine practice, and we were nationally recognized as an exemplar practice by the Robert Wood Johnson Foundation a couple of years ago. So we're proud of the work we do, and we're proud to be in Westminster, and these are pretty tough times, and so we wanted to reach out and to the community and help where we can. And we're all asked to do a lot of changes now. These changes are difficult. And so I wanted to give some background on why we're doing these changes, because it's hard enough to do them. And if you don't believe in them, it's even more hard. So hopefully after our little discussion today, you'll understand better why we're being asked to do what we're being asked. So next slide, please. So yes, this does involve a little science, so for those non-science people, I apologize, but I'll make it painless as possible, because really there's just a couple of points to get from these slides, and I'll try to make it as entertaining as possible. But this slide basically is showing all the different types of tests out there, and they have limitations. And this is just plotting the accuracy of the test against the onset of symptoms, the timeline of symptoms. And you can see it, different tests will tell you different things at different times. So it really requires an interpretation. And the right test has to be done at the right time. So it's not just go, everyone get tested and we'll have this virus under control. It's got to be done with thought, and it's got to be done properly. So next slide, please. Next, okay, there we go. So what are the tests? There's more than 2 tests, but these are the main tests, the PCR test and the ELISA antibody test. And the PCR test is an RNA test. So the coronavirus does not have DNA. It has RNA. So RNA is 1 strand, DNA is 2 strands. And so it's a primitive sort of life force. And this test will detect the presence of the viral RNA. And so not the whole RNA, but pieces of it. And it's done through nasal swabs or sputum or saliva. And actually saliva is the best test, but it's not really commercially available. And it will tell us that you either have a current infection or you were infected sometime in the last 6 weeks. Doesn't tell you which. So it does have benefit. So if someone comes in sick, I can make a diagnosis and you have COVID, and I can say, oh, you've been exposed in the last 6 weeks. So it has facility, and but it's also used as a public health tool, and very helpful in that regards. The antibody test detects the antibodies that your body makes to the virus, and it's a blood test, and it indicates that you have developed an immune response, that you've been exposed. It doesn't say when, and it doesn't tell you that you are immune to the virus. It just says you are developing immune response and you've been exposed. So it's mostly a public health tool on helping us understand the prevalence of the disease, where it is, and perhaps the frequency of asymptomatic carriers, maybe the amount, helping to decide who's going to be a good donor for plasma. But it doesn't have a great deal of utility in helping you know what to do. And in fact, as we will discuss later, it may cause more harm than good. Next slide, please. So I thought you just might be curious about how these tests work. They're not that easy. If you look at the little cartoon on the right, you take the swab and then you have to isolate the RNA out. And then you got to throw in a whole bunch of chemicals to make that RNA into DNA, the double strand. And then you have to add a whole bunch of chemicals and some fluorescent dye, and you have to heat it and cool it to make millions and millions of these copies of DNA that a machine can pick up the fluorescence. And then that tells you you have the disease. So it's a fascinating test. It requires a lot of chemicals, and so it's best taken 3 days to 7 days after symptoms start for the best accuracy. Although it can pick up virus 6 weeks after the fact when you're no longer infected. And there are a lot of false positives and false negatives, which means that may be positive and you don't have it, and it may be negative and you really do have it. And that depends upon the manufacturer. There's a lot of companies that are fraudulent. The FDA allowed anybody to submit a test without validation. So there's a lot of crummy tests out there, home tests that tell you nothing. And or they have errors with collection and transport, contamination, degradation. So you have to pick out of the hundreds of tests out there, there are some that are very good, and you have to make sure you get those. In fact, I know England just bought a whole bunch of tests, $20 million worth of tests that they threw out because they were just basically fraudulent, came from China. And it takes about 2 to 3 days at best to get them, although children's you can get it back in a day. And, you know, we run out of the chemicals. Next slide. So the antibody test is the same principle. It's a little different, although they take the virus itself and they stick it in a tube, and then they run your blood over it. And if you have antibodies to that virus, the antibodies will stick to the virus. And then they make antibodies to your antibodies with a little fluorescence, and they will stick to the antibodies. And then they put it in the machine to see if it fluoresces. And that's how they test for antibodies. And this is the gold, and ELISA testing is the gold standard. It's highly accurate. If you do the test at 20 days, it's 100% accurate if it's positive. Trouble is that there are 7 coronaviruses, and it will react to every one. And 4 of those coronaviruses are the common cold. So which do you have? Do you have COVID-19, or do you have the common cold virus that it's reacting to? So again, the test by itself is not helpful unless it can be interpreted. And this is mostly a public health tool, although it does have value with finding donors. And I do use it occasionally just to figure out if someone had it, a month ago or whatever. But the problem is, and this is where it does harm, it does not tell you you are immune. It just tells you that you were exposed. And now, there might be future tests that do, but the current ones do not tell you that you're immune. So if you go out and you stop social distancing, stop wearing your mask because you're positive, well, you may be sorry for that, or somebody else may be sorry for that. And the other problem is that there are 14 mutations of COVID-19. And if you are immune to one, it doesn't mean you're immune to the other 13. So this test has to, again, be used with caution and for a very specific reason. It does not tell you that you're immune. It does not tell you that you're actively infected. It tells you that you were exposed to some coronavirus. So it has limitations. Next slide. So this is the most important slide. And I'll go through it so it's understandable and hopefully you can read it. And this is what Governor Polis looked at to make his decisions. This comes from the State Health Department. And there are basically 5 scenarios that they're looking at, A through F. And I put up A on top and F on the bottom. And A is basically if we just social distance and what will happen. And scenario F is if we social distance and wear masks and we isolate our vulnerable population and we do contact tracing, what will happen? So if you look at, and then there are different curves on there, and that's the amount of social distancing. And I don't think you can see it very well, but it's a percentile of either 45% social distancing up to 65% social distancing. And all that means is that if you're 65% social distancing, which is good, that means the population is mingling with about 1/3 of the people they usually have contact with. So they avoided 65% of their contacts. If it's 50% social distancing, you're seeing half the people that you normally have seen. So depending on those curves, if you go up to the top right, you can hardly see it, but there's a dashed white line. And that's around the 2,000 mark on the left vertical axis. And that's the amount of ICU beds. Every scenario of every amount of social distancing will exceed the ICU beds by September. And then you can even throw in the hospital beds, which would be around 8,000 to 10,000. Every curve will exceed the hospital beds by September. So that means people will be dying at home, dying in the halls, if we just do social distancing. On the contrary, if we do all the stuff that Governor Polis is asking us to do, unless we don't social distance, we social distance less than 50%, we will pretty much have a flat line. We'll have cases, but we'll be able to control them. We'll be able to hospitalize people, and we'll be able to give them the treatment that they need. Next slide. So how does this little virus work? Some other things you need to know, because all this stuff is going to help you determine what you're going to do in your business. So if you look at the size of this thing on the right-hand box, That's in microns, and a micron is 1/1,000,000th of a meter, and a meter is 3 feet. So the human hair is 70 microns, and the coronavirus is 0.1 microns. So if you look at the cartoon and that little figure of a person who's sneezing or coughing, and that person's coughing out a whole bunch of particles that are different sizes. The good news is that the COVID, it seems to attach to respiratory droplets, which is about 5 to 10 microns in size, and that is going to be filtered out by a surgical mask. So if the person's wearing a mask, they will probably not transmit it to somebody else. Those droplets generally drop out somewhere around 3 feet, but they can go up to 6 feet. That's where the 6-foot rule comes in. But there's a lot of other droplets out there. There are a lot smaller ones, and sometimes they're aerosolized, and the COVID comes out at 0.1. And those can travel further. They can actually travel up to 27 feet, depending on air currents and whatnot, and they can stay suspended in the air for 3 hours. So, we come up with these rules, but they're no guarantee. And here's the problem. N95 masks only filter out 0.3 microns, and the virus is 0.1 microns. So even the N95 mask is not 100% effective. So unless you're in a hazmat suit, if you're exposed, it's possible you can get the disease. It's unlikely because fortunately, most of the stuff comes in the big droplets that can be filtered out. But occasionally, if there are certain procedures or certain conditions in this aerosol that comes out small, you can get infected. Next slide. Homemade masks, yes, they're helpful. And if you can't get a surgical mask, then you get a homemade mask. And the little red box on the right-hand side, it shows a surgical mask will filter out 90% of large particles in the 5 to 10 micron range, which are the respiratory droplets, which are the most of what COVID is carried on. But, T-shirts work at 50% efficiency, although that's 40% less effective than the surgical mask. It still works. And it goes through other particles, even a scarf is 47% effective, which is amazing. And so different fabrics do better than others, but if you actually layer them up and put 2 layers that are maybe perpendicular to each other, you're going to get more efficacy. But homemade masks work, especially if you put them over your mouth and your nose. And I see a lot of people who just don't put them on properly, and they're just hanging there, and they have gaps all over the place, or they just have it over their mouth, and I don't know what they're thinking, but it doesn't work very well when you do that. So next slide, please. So let's talk about the transmission. Again, just to be clear, because this is how you protect your staff and you protect your customers. It's going to be transmitted either by contact, things that you touch, by the respiratory droplets, people sneezing, or by airborne. Not that often. That's usually more dangerous to doctors and clinicians because they're doing procedures and they're aerosolizing this little virus, but it can happen. So the contact is as well that these droplets fall onto surfaces. And so if you touch a table or a chair or a banister and then touch your mouth, your eyes, or your nose, then you can transmit it to yourself. So that's easy. If you clean the surfaces, or you wash your hands, or you don't touch your face, then you won't get it through contact. Simple. Droplets, that's where the social distancing and the masks come into play. If someone has the COVID-19 and is wearing a mask, they're unlikely to transmit it. If you're over 6 feet away, you're unlikely to get it. So those are very important precautions to take. Airborne, again, is a little bit of a problem. The only way you can not get it by being airborne is just be isolated and not being in contact with a person at all. So older folks stay at home. And that's where that comes from, or you have a full hazmat suit. Next slide, please. So this is the sort of public health principles of how to control an epidemic, and it goes through different things. And so you can think about this, how it might apply to your business. It's elimination, substitution, That's basically distancing. Elimination is you totally isolating yourself. Substitution is that you just have contact with people on a limited basis. But then there's the engineering controls. How do you clean your facility and keep your hands clean and things like that? Administrative controls. How do you control the distances of people and the mingling and the staffing to keep people apart? And then the PPE, the personal protection equipment. How do you keep the germ off you if it happens to get through all those others? Next slide. So all this stuff is in great detail on the resources that I have on the websites that I cite at the end. So it's all available to you, and I'll just go through them again and think about them, how they might apply to your business, because every business is very different. So you have to be a bit creative how you're doing it. But these are the principles, and they're all covered by Governor Polis's guidelines. And one, it's screening and testing. So try to prevent people, your employees who are sick, to come in, who might then infect your other employees and cause a pretty bad situation. So you do that by taking daily temperatures. And if they have a temperature 100.4 or higher, they should go home and get tested. We do, at our practice, we do daily temperatures twice a day on our staff, and we do a COVID-19 screening questionnaire to make sure, again, asking them every day, do you have a cough, a fever, a rash, a headache, fatigue, whatever? And if they do, they get tested, they go home. We also, in our practice, will do that screening on our patients, and so that if they are positive, they go directly to an isolation room so they don't mingle with anybody in our office for our patient safety. Social distancing, of course, the 6-foot rule is pretty good. It's not a guarantee. How do you do that? Well, anybody with a small business is a creative person. You got to figure out on rotating your schedules, or staggering your schedules, or doing telework if it's possible. And that's where decreasing your staff 50% comes into play, just to try to keep the distances apart and not have more than 10 people in any one area. And that gets back to that 65% social distancing. If we don't do that, then it doesn't matter what else we do. We will overwhelm our hospitals and cause a lot of extra disease and death. Customer flow. Well, how do you keep customers from mingling and lining up? And that's where you put X's on the floors and things like that. In our practice, we have people coming in one door. We have a one-way street, and they go out another door. So there's no mingling or cross traffic. Masks. Employees and customers, should be wearing masks. Now, we require our patients to wear masks, and so we have masks that people come in and they don't have them, we give them to them. And you can't always require people to do things, but we will not see patients unless they are wearing a mask, and they will not come into our facility because we have to protect other people, some who are quite vulnerable and have to be seen. But you all have to decide on what you can do. But make sure your staff is wearing masks, and make sure your staff is wearing masks properly. Hand washing, that goes without saying. People touch their face 100 times an hour, and if not more. No touch trash cans, a simple type of thing just to help keep the area clean and keep things off your face. Vulnerable populations, the best you can do to keep people home is very important. Over 60-year-olds, Governor Polis says over 65, I say over 60. Those with chronic diseases, which is unfortunately 50% of Americans, adult Americans, have one chronic disease, hypertension being a big one. So a lot of people are very vulnerable. And do curbside delivery, virtual, whatever you can do to try to keep those people, or get them out of the building as quickly as possible and as efficiently as possible as you can. And cleaning is very important. You can clean with soap and water, which is the best. 60% alcohol works for your hands. If you're scrubbing something down, the CDC says 70% alcohol. Bleach works. It's 1/3 of a cup per gallon of water. Now, we do something a little different that's not recommended by the CDC. although I think there's enough science to justify it. And we do have air cleaners. We have 4 air cleaners in a 4,000 square foot space, and it cleans the air, rotates, cycles the air through every 10 minutes, but it cleans down to 0.1 micron, the size of the coronavirus. Most of them, and it's expensive, because most air cleaners won't clean anywhere clear near that. They clear in the 5, 10, hundreds of microns. Some get down to 0.3. You have to find there are a few out there that are really good. Consumer Report actually did a review on them. But I think that's just something, again, that we do to be extra safe for our patients. And we use ultraviolet C light as opposed to the usual ultraviolet light you get outside. And that's a germicidal and kills everything. So we have just ordered that up, but that's not something you can keep on at all times. It has to be, you have to have humans out away from it. So if we have a contaminated room, you can put a light in that room, and in 15 minutes, everything's sterilized. So you don't want to be in there. And but they do have handheld things that food industries use a lot to keep things clean. So there is a lot of commercial companies that sell that. And then returning to work, when do they come back to work? It can be test-based or time-based. The time-based just is the easiest. 10 days after symptoms, if you've had no fever for 3 days and you're getting better, come back to work. Test-based would be, no fever for 3 days and then 2 consecutive negative tests 24 hours apart. A little bit more difficult to do. And it may end up being 7 to 10 days anyhow. So next slide. So take-home messages: follow Governor Polis's policies. They're well thought out. He has listened to science, and they are reasonable. Okay, they're not perfect, but they are reasonable and they're practical, and they will work, and we'll be in a big load of trouble if people ignore them. Daily, only test people who have symptoms. Asymptomatic people should be left to clinicians and public health to figure out, unless you are an essential business and you need to sequester your employees and have them tested because of the nature of your business. We're testing people for who do power supply, and they sequester their patients for 2 weeks, and then we test them. Always wear your mask and wash your hands frequently. Prepare a business continuity plan and a pandemic response team plan. Again, what are your protocols? What are your supply chains? All that type of stuff you got to be thinking about. The 2 resources there I listed have it in great detail. They're very good. One's from the state of Colorado, one's from the CDC. Very readable, very detailed, and can be reviewed. Caitlin Barba is our practice administrator, and you can zip her a line if you have a question that might apply to your business. Next slide. So again, just to close out a little bit more about our clinic, we're kind of a one-stop shop. We do comprehensive outpatient primary care, a lot of advanced cardiovascular testing. We have health coach, we have a pharmacist, we have mental health in our practice. We have a pharmacist and x-ray and lab. So pretty much can get everything done for you. We're open. We've been open since the start of this epidemic. We're accepting new patients, including Medicare. And there's one thing you businesses may want to be interested in is direct primary care. And next slide, please. This has been a tough time. People have been laid off. Businesses are struggling. So direct primary care, something you may not have heard about, is where our practice provides all the primary care services to a person for a flat monthly fee. Very affordable, $99 per person. There's their family rates as well. And they get all their primary care taken care of. Things outside of general primary care, like x-rays and labs, we can get at discounted rates. Of course, specialists and hospitals are not covered, so it's best to be linked with a high deductible health plan. And if you do that, then actually it can be less expensive than a lot of health plans out there when you combine a high deductible with a DPC product. So a little bit more transparent than what you get with just a plain health plan. You know what you're getting, you know where to get it, and you're getting an awful lot. Something that is going to be helpful for someone who's lost their insurance or as premiums get higher and higher consideration. So next slide. And that's our practice manager, her contact information if you're interested or have any other questions. So I went a little bit longer than I thought, sorry, and but hopefully if there are questions, I'm still available for a half hour to take them if Juliet's available.
That's terrific. We're going to go over on time, and that's totally fine. If you're okay with it, this PowerPoint I will make available on our Chamber COVID resources page. So anyone that's tuned in or anyone that watches the replay can have access to a lot of that data that you were sharing. We do have a lot of comments and questions, so I want to be able to get to those. If you'll give me a quick second while I look through here. Looks like we have a few other folks. Mark Clark, hello to our chairman, Brian Dice. Counselor Bowles, thank you for hopping on, and Emilio. This question, it looks like it comes to us from our board chairman, Brian Dice, and his comment, he's asking, based on what you've seen and are sharing with us, how accurate do you believe the data we're being given regarding how many people are testing positive and also the deaths that are being reported as COVID related?
Well, I think that a good question. And I think it's pretty accurate. I think that the deaths are not accurate. A lot of places are kind of reporting other causes of death, and they're not calling them COVID. So I think we've under reported deaths from COVID quite a bit. I think you can probably because of the asymptomatic carriers, people who've had COVID and did not know it, or were so mild they didn't think about it, is probably 7 to 8 times larger than reported numbers. So if we report 10,000 cases in Colorado, there have probably been 70,000 cases. So I think what you're seeing is you're getting the reports of the people who are pretty sick, which is not quite the tip of the iceberg, but just a portion of the big picture. And I think so it underestimates the severity and the danger that we're facing.
Okay. Brian also kind of shared, just kind of thank you for, oh, that was, I think, a comment somebody else. It looks like we have one of our past board chairmen as well, Brian Head. Can Dr. Ammon comment on the effects of COVID-19 versus things like the flu, pneumonia, or strep throat, both in contagion and severity?
Well, COVID-19 is worse than the flu. And they have the R-nil factor is how many people will be infected with one COVID person. So if you have COVID, you generally will infect 2 to 3 people. If you have the flu, it's usually you will infect 1.5 people. If you have measles, you'll infect 20 other people. So COVID-19 is up there, and so it can spread pretty quickly. It does the death rate with it in terms of compared to the flu is again also worse. Again, it depends on what state you're in, what population you're looking at. I mean, I saw a statistic that 5% of Coloradans are dying who get it, and whereas the national average is more like closer to 2%. So I didn't verify that number, so I was a little shocked by that. But it looks like 2% of people, or 1.5 to 2% of people are dying. But again, it depends on what population you're looking at. If you're looking at a 30-year-old versus an 80-year-old, so this is a deadly disease. Pneumonia is tough because again, it depends on your age and what type of pneumonia you have. But COVID-19 is basically a Russian roulette virus. You don't know how it's going to respond. You don't know what symptoms you're going to get, and you don't know who it's going to kill. And it's deadlier than the flu by far. And strep throat to me is kind of something is a rare problem, now that we have penicillin, but clearly is not nearly as dangerous as COVID-19.
This next question comes from one of our other board members who's also a small business owner. Where can we get the testing? So I know you mentioned at your individual clinic and some of the things that you all are offering that are there. If a business on their end, and you alluded to, there are a lot of tests out there. There are some that are more accurate than others, some that are different manufacturers, different pricing, things of that nature. So would it be best in your recommendation that businesses just generally send people to clinics to try and do that? Or if they are trying to take that upon themselves to do the testing, where would they look at getting those testing?
Well, the recommendation is to test people who have symptoms and not to test asymptomatic people unless it's being done by public health. So, going to so assuming that, and so who's doing the testing? Well, hospitals are doing the testing, public health is doing the testing, clinics are doing the testing. I don't know I know I heard some urgent care was doing testing. They did it in 15 minutes. And I know that's bogus because there is no, there are some 15-minute, there are no 15-minute PCR tests right now that are available. So there are antibody tests, but so it's, I contact your doc and see if you can arrange something, some relationship or partnership with sending your employees over there to get tested, seeing what tests they have and whatnot. Hopefully they've done their due diligence. I don't have a list of where because we do our own testing. I don't have a list of where people can go. So.
Yeah, and I think that's a valid point. Even you just sharing, there isn't really a test that takes it in that short period of time. So as people are seeing maybe options that are available, is to do a little bit more research than just, I can, go through a drive-through express, get this test done and come back out. There is more to it than a basic.
The new test is coming out. This got approved this week. It's an antigen test. It works differently. Mm-hmm. So it's a 15-minute test or a 10-minute test, and it will tell you if you have the disease. It's like the PCR, but you don't have to wait a day or two. Trouble is, it's only 80% accurate. Mm-hmm. So it's not to be done alone. So if you're saying, you're okay, you can come to work. No. I mean, that's not going to work. Okay, you're putting people at risk. So I wish we had like the magic pill of testing, but we don't. And it has to, we have to make tough decisions. And so, and we have to do it right, and so there's nothing easy about doing it right. So.
Mm-hmm. Absolutely. Hello, Kim. Thank you for commenting on the video. Looks like we have Bonnie. Bonnie's sharing great information. Thank you. We also have another small business owner, such helpful information. Thank you for this. Brian's back with, it looks like, another question for us. He's sharing, he recently read an article that calls to suicide hotlines have increased more than 800% since the beginning of the stay-at-home orders. Is the Westminster Medical Clinic seeing an increase in mental health needs in our community? If so, can you share what services are available for people in need during this time?
Well, yes, there has been an increase in suicides. Yes, there's been an increase in loneliness. All mental health issues have accelerated. We have 2 mental health providers in our offices, so again, we have the luxury of immediate services. They are from Jefferson County Mental Health and Jefferson Center for Mental Health, and there is a hotline. A crisis line, and maybe we can get that and get it posted for people to call and to get people in. They do televisits as well, and we do televisits. We actually have an outreach for all our patients, just to have other of our patients to call people for loneliness. So, but I would recommend the crisis line through Jefferson Center for Mental Health as a place to start for people who need outreach. And again, they don't know boundaries too much, so they work for Adams County too. Now, for Adams County would be REACH, I think, the mental health group there, and they would be the person, I think, the organization to call. And I'm sure they have a hotline and a crisis line, and they take Adams County. So that would be where I would look for.
Absolutely, and you're quite accurate on both of those. So Jeffco does have some support, and then we have the Community Reach Center that's on the Adams County side. Community Reach just launched their free warm line for folks that can call in, and they even launched a COVID-19 Heroes program. So anyone that's kind of a first responder on the lines that's been responding will actually receive 6 free sessions at no cost to them. So there are definitely some benefits or some resources that are out there for folks that may be suffering or may know people that are suffering, especially during this month of May. We just did an industry town hall related to mental health, and I'd highly recommend that as a resource for folks. Dr. Hammond, I do want to thank you for taking the time to come up here and share with us your PowerPoint. You had a nice combination of data-driven points, but then you also collectively gave some steps and suggestions. A lot of what we're doing right now is we're moving to the safer at home, is the orders that were disseminated across the state by our governor and then subsequently by our counties. We've linked those and made those available to people on our website, in our emails, so that you can know kind of what the recommendations are, what the guidelines are. As you're opening your business, you can take that into account. We're also in the process of launching something here in a couple of days. I can't really go into too much detail on it, but it'll touch a little bit for businesses on best practices. So I know you mentioned about, at your clinic, you have where people should stand. We see that a lot at our grocery stores. They've got boxed areas in, or they'll have an X mark where you stand for social distancing and more. So we are pulling together a lot of those resources and things that businesses have done that we've seen that have been successful. But, one of the key takeaways from this discussion was that it's a holistic approach. It's not just one thing that you can do, but it's various things. It's things that businesses can proactively be thinking about and developing, and then things that you as a customer or consumer can be taking into account. Don't go out if you're not feeling well. Make sure you're washing your hands, you're keeping germs away, you're not touching your face, you're wearing your mask right if you have it, and basic things like that. So, and I think that it's definitely, it's your business and your overall community, that's what's needed to really move us forward. We have one last question from Brian before I have us hop off, and that's, does Dr. Hammond believe that these types of viruses are going to become more and more common as viruses evolve and population density increases? We're currently building a high density population center here in Westminster's downtown area.
No, I think yes, we'll be seeing, it's not that easy for a virus to leap from an animal to a human. Yes, as we mingle, it does happen. We've had a lot of near miss pandemics: Ebola, West Nile, Zika, H1N1, SARS, MERS, over the last 10, 20 years. They were handled properly, okay? And it did not become a pandemic. This one's a little different virus, it's a little bit unusual, handled poorly. So this is not new, and it will continue. And I think hopefully the country has learned some lessons from this, and how to take and how to better prevent pandemics in the future. I am sure we will have like in any world war, there's so much advancement and progress that happens because of what comes out of that tragedy. And so the same thing will happen here. We'll have better tools on making vaccines quicker, and understand how to do testing better, and get things in. And hopefully this country will become a manufacturing country again, and we won't rely on outsourcing so much. Lots of things that play into that.
Absolutely. Ingenuity and innovation.
I want to make one last comment, though, as we close out, is that on our website, we do have a lot of resources about COVID, and also contacting also mental health resources as well. So if you go to www.westminstermedicalclinic.com and you just scroll down to COVID-19, there's a good source of information. I know everyone is information overwhelmed, but this is vetted, it's good, it's understandable, and it covers just about everything. And there's a lot of mental health stuff on there that you might find helpful for your employees.
Absolutely. And that website again is westminstermedicalclinic.com. Thank you from Brian. We also had a comment earlier from Priya related to face masks. Priya, I don't want you to, I think I skipped over you. Last night we had City Council kind of take up that discussion, and there was some direction from that. We'll include that for you as well into the link section. For those of you that are free this evening, we are having our first socially distant event. So think of speed networking in cars, time blocked at a maximum of 10 people per few minutes. We're making sure that people are strongly encouraged with their masks. We'll be over at 5280 Burger Bar. You do need to register in advance, help support a local business, and help us try out this socially distant event to make sure that, keeping everyone safe and healthy is still possible while we're fueling the economy. That's from 5 to 7 this evening. RSVP is at westminsterchamber.biz, and there's more information here on our Facebook page. If you're watching this as a replay, give us that hashtag replay and let us know if you have any comments or questions. We can get back to it. We will come back here tomorrow at 11 a.m. and we'll have with us our General Counsel, Mike Lazar, who will share kind of the legal implications of reopening. Some questions are arising as business owners are looking to open back up. What does that look like? How do you address them? And what precautions can you take to be as informed and as compliant as possible? Thank you again, Dr. Hammond, and thank you everyone for tuning in today. Bye-bye.